Hi, in this video we'd like to talk about a specific type of PCOS classification. Specifically, this classification is known as the obese PCOS classification. So this group of patients are usually the ones with a symptom of high body fat. So they are usually obese. Their BMI is of the obese range. So they have high amounts of body weight, body fat, and along with this PCOS. So it's not that all patients of PCOS will see high body fat, because usually we associate PCOS patients to be either fat or obese, but that's not necessarily the case, because there can be patients who have no insulin resistance but also still have PCOS. They can be very slim and they do not have any other physical symptoms, but they do still have the internal symptoms of PCOS, which is the high testosterone, the anovulation, the miscarriages, and also infertility. These are all classifications. So today we'd like to talk about the ones about obese PCOS patients. So for these patients, even if they go for our treatment of the removal of the abnormal tissue within the ovaries, the testicular tissues, these patients, even if they see a successful treatment, no remaining tissue left, these patients have extreme difficulty in losing weight on their own. So these patients, after the surgery, they can still go for all kinds of rigorous exercise for a period of 6 to 12 months. They will see very little improvement. Now, why is this? It's because it's due to an underlying organ malformation tied into this PCOS. These women cannot lose weight is because they have a malformation of the stomach. This malformation simply means that they have a slightly different shape, slightly larger shape, and also a lower angle of the tilt of the stomach. It simply means that it's situated like a bag, almost horizontal to your diaphragm. So this means that it can carry a larger amount of fluids and also calories. The intake of food can be much larger than your healthy normal counterpart, which is why these women tend to see high difficulty in losing weight. And even after they go for the treatment, they still see not only they are unable to lose weight, they still cannot get pregnant or have difficulty in conceiving. This is also tied into the high body fat that they have, because obesity can cause infertility. So for this type of patient, you need a comprehensive treatment. We here offer you a much more comprehensive package depending on your classification. So if you are diagnosed as an obese PCOS patient, you not only need to go for the removal of the testicular tissue using laparoscopic surgery, you still need to, at the same time, surgery can be conducted at the same time, so you don't need to go for multiple trips to the hospital, multiple procedures. This procedure can be done at the same time at Antai Hospital. So we will still be using laparoscopic for both procedures. First of all, we will be doing on the ovaries first, remove the testicular tissue, and after that we will then move to the stomach area. This time we need to use laparoscopic surgery to conduct a sleeve gastrectomy, which means we'll be excising a portion of your stomach and also restoring the tilt. So a healthy tilt is usually around 45 degrees, and then a much smaller volume of stomach volume. After this procedure, patients can see not only the symptoms going away, you can see that you will lose weight incredibly fast and also can maintain a healthy BMI as well. So this is very beneficial for the mother. She won't have any of these dangers and complications of being pregnant if you are obese. For example, gestational diabetes, gestational hypertension, and the incredible amounts of stress on your heart when you're obese and carrying a pregnancy. So with this procedure, we can solve two problems at the same time. Not only do you see the symptoms alleviate, no more excessive body hair, excessive acne, and you are beginning to ovulate regularly, you are menstruating regularly, and you can also sustain healthy full-term pregnancies on your own. And you can also maintain healthy weight, healthy physique throughout your life, just going for these two procedures at the same time. So Antai Hospital offers this treatment for patients who are struggling to lose their weight, especially those who have gone for PCOS surgical treatment and still struggle for 6 to 12 months. That means this organ malformation is the root cause, and we need to use a laparoscopic sleeve gastrectomy to solve the underlying root cause. So get in touch with us via the website if you'd like to find out more information. If you're interested about these ovarian tissue, testicular tissue removal, and with sleeve gastrectomy, please get in touch with our consultants. Let's arrange a consult and let's discuss how we can assist you to not only lose weight and also achieve a healthy pregnancy today.